Now, to investigate the case further, and basically you're leading on to the definitive diagnosis in this particular case, we just went through the fact that the particular patient in our case study was also suffering from visual problems. So the ophthalmological evaluation is very important over here. You basically just want to investigate what are the reasons towards the bitemporal hemianopia, and you'd be basically carrying out the visual field test for testing out this visual field defect. Homonymous hemianopia, depending upon whether the pressurized symptoms are on one side or whether they are affecting bilaterally by rendering the pressurized symptoms on the optic chiasma. Then diplopia, that is the doubling of the vision or the blurred vision, is one of the features that is predominantly seen in the patients as well. And then we have the optic atrophy that is also seen in these patients. Moving on, we have the visual loss that can encompass eventually if the patient is not treated in a proper way. So this is something that we are going to evaluate, what kind of a vision loss that he's suffering from. And obviously you can use a range of Snellen's charts out there to basically evaluate this vision loss in the patients. The misalignments, that is the ptosis, is one of the features that is seen in the patients, that is the drooping of the eyelids. And then we have strabismus, which is basically the squinting phenomena, which it can also be seen due to the extraocular movements that are involved in the patients as well. Then when we have basically examined the patients, we can move on with the lab investigations. We can carry out the basal prolactin levels that were quite raised in our case study. IGF-1 was basically calculated, 24 hours UFCs were calculated for. We move on with the overnight oral dexamethasone suppression tests, and all of these tests are basically indicating the fact that we are basically finding out whether some kind of a hormonal secretion is in excess or not. And that is basically going to help us out whether it is an anterior pituitary or a posterior pituitary adenoma that we are dealing in with. Alpha subunits, then we have the FSH, which is again secreted by the anterior pituitary hormone. The LH is also secreted by the anterior pituitary. The thyroid function tests are again going to enhance the fact whether it's an anterior or a posterior pituitary, as TSH is basically being secreted by the anterior pituitary lobe. Now, as we just went through the fact that sometimes we are not dealing with the adenomas and it's the Rathke's pouch or the Rathke's cyst, or sometimes it is the dermoidal cyst. So we would sometimes want to have the biopsies done in these particular cases and the histological evaluation just to know what kind of a cellular differentiation, whether it is a benign tumor or whether we want to basically know we are dealing with a carcinomatous kind of a condition in the patient, because the prognostic factors and the treatment guidelines are basically going to depend upon the final diagnosis in a particular patient. So it's again very important to look for these particular definitive diagnoses in these patients and plan accordingly in these particular cases.